makes this 5th anniversary quite special is that we have 2 alumni speaking with us, Dr. Tara Schwetz and Dr. Bill Riley, both of whom now hold leadership positions with the National Institutes of Health. These individuals are a testament to the value, the quality, and the power of education in health at FSU, as well as the importance of integrating research and education, as you'll hear from both of them. Let me now introduce Dr. Tara Schwetz, who is Associate Deputy Director of the National Institutes of Health. Prior to assuming that role, she was the Chief of the Strategic Planning and Evaluation Branch with the National Institute of Allergy and Infectious Diseases. She's also previously served as Senior Advisor to the Principal Duty Director of the NIH. She received her bachelor's degree in biochemistry from Florida State University, where she worked closely with Professor Tim Logan, and she went on to receive her PhD in biophysics from the University of Florida. So I will hand the screen over to Dr. Schwetz. Please welcome her. Thank you.
Thank you. Good afternoon, everyone. I'm so grateful to be here today, and sorry, of course, that I can't be in Tallahassee for this presentation. As mentioned, I was asked to give a little bit of a overview of NIH's approach to promoting collaboration and innovation across different disciplines, and with a particular focus on physical health. So if we could go to the next slide. But first, jump right in. I was also encouraged to share a personal connection to Florida State. So as mentioned, I went to undergraduate there. I personally love Florida State. I have a deep connection to it. I'm a first-generation college student, so that was really a crowning achievement for me to be able to graduate and get my bachelor's there. And I learned so much about research there. I met my husband there, actually. I met a ton of good friends. So I have a really deep connection, I feel, to Florida State. I spent 2 years working in Tim Logan's lab on my honors thesis project, where I learned about what it means to conduct science and to design experiments, to ask scientific questions, to write grants. I got an American Cancer Society fellowship while I was there. And also what it means to be involved with and engaged with academic research. So that actually prompted me to go down my current career path, and that experience encouraged me to apply to graduate school and get my PhD in biophysics. So that's really my connection to Florida State. But I was asked to speak with you all about interdisciplinary research and building collaborations and partnerships on promoting physical health. So if we could go to the next slide, I will jump right in and talk about how NIH does this. We can go to the next slide. So NIH's mission is to seek fundamental knowledge about the nature and behavior of living systems, and to apply that knowledge to enhance health, lengthen life, and reduce the burdens of illness and disability. And I just want to really give a quick background to those folks who may be less familiar with NIH. Just talk about, kind of the scope of what we do up here in the DC area. So we are about a $42–43 billion organization, and the bulk of our budget goes to supporting research in one way, shape, or form. About 80% goes to supporting institutions outside of NIH, like Florida State, and we do this mostly through grants. We review 70,000 to 80,000 applications per year. And that means we need to recruit quite a few reviewers, and probably some of you are involved in our study sections. And this helps us to make the decisions and get the information that we need to make awards to over 2,500 different institutions and over 300,000 NIH-supported researchers. We make these awards through our 27 institutes and centers that we have. Each of them are focused on a different area of science. Kind of like to say that they're either body part or disease focused for the most part. We have, the National Cancer Institute and the National Heart, Lung, and Blood Institute are two examples of that. We also have the Office of the Director, which is where Bill, who is going to speak with you tomorrow, and I both sit. And the bulk of the rest of our resources actually go to supporting researchers here, mostly based in Bethesda, Maryland, conducting research on campus at NIH. And over its history, NIH has supported, and we're really proud of this number, 163 Nobel Prize winners, including our very own Dr. Harvey Alter this past year for his work on hepatitis C virus. We could go to the next slide. And if we could just, tick through these. Most of our budget, as I said, goes to extramural research. It's about 80%. And our primary approach to supporting research is through one of two ways. The bulk of it, over 60%, is used to support ideas that we get from researchers. So we have parent announcements that are out that just say, you know what, you guys send us your most brilliant ideas and proposals on any topic. And that's investigator initiated research. The other approach we use is when we identify a scientific gap or priority, or we want to organize a major initiative to really accelerate knowledge in a particular area, that we call our solicited research. And I'm going to talk about some of our programs that fit more into that latter bucket in a moment. And we solicit applications from folks in the community through our funding opportunity announcements, or FOAs. You go to the next slide. I'm not going to talk about this in a ton of detail. It's a lot going on. It's our sort of funding process, but I just want to point out that NIH uses a 2-level peer review system that includes both our scientific panel review, which is sort of more commonly known as study sections, and that's our first level peer review, as well as our national advisory councils who conduct the second level peer review. And ultimately, the IC director for the relevant institute or center makes the final funding decision that utilizes resources that we are appropriated by Congress. We go to the next slide. So more specifically, I'll talk about a few programs, but I hope that gives you a sense of what NIH does and how we operate on a really high level. But in talking about some of the ways that we have promoted collaborative research over the last few years, I think this is a great example of one of the ways, and that's through our Sound Health program. This program aims to expand our current knowledge and understanding of how music impacts the brain, how we can enhance the potential for music as therapy for certain neurological disorders, identify future opportunities for research, and of course, help to create public awareness of how the brain responds to music. To me, again, it's a great example of how to establish partnerships with organizations that, for us at NIH are not necessarily our typical collaborators. You can see down at the bottom of the slide, we partnered with the Kennedy Center, the National Symphony Orchestra, and the National Endowment for the Arts as part of this program. And we currently actually have a few funding opportunity announcements that are currently open for this effort. Go ahead and go to the next slide. So sort of, I guess, in keeping with the theme of the brain, we have the Brain Initiative, which is our brain research through advancing innovative neurotechnologies initiative. It's really about trying to revolutionize our understanding of the human brain to accelerate the development and application of innovative technologies. And what we're trying to do is build out a picture or a map of how individual cells and neural circuits interact, both spatially and temporally, and explore exactly how the brain controls how we move, how we plan, how we remember things, and allow us to understand how to monitor or manipulate, when we need to, circuits for improved function. So if you think about those folks who may have been injured, how can we improve function in an area where damage has previously occurred? And of course, identify how brain circuits cause neurological, mental, and substance use disorders. This effort, the Brain Initiative, has been around for about 6 or so years now, and has given out more than 700 awards to hundreds of investigators. You can see it's almost $2 billion that have been awarded. It's really at NIH a trans-NIH effort amongst 10 of our institutes and centers, as well as 4 other federal agencies. You can see some of them listed down at the bottom. These include places like DARPA, IARPA, FDA, NSF. Federal government loves acronyms if you haven't figured that out yet. But we've also, as part of this effort, partnered with private foundations. We could go to the next slide. So to reverse the opioid crisis that continues to grip the nation even despite the current COVID-19 pandemic. NIH is supporting the Helping to End Addiction Long-Term, or the NIH Heal Initiative, which is a trans-NIH effort composed of over 12 ICs to improve treatments for chronic pain, curb the rates of opioid use disorder and overdose, and achieve long-term recovery from opioid addiction. And this is a large program that we have that has made hundreds of awards to almost every state in the nation, and is really taking an all hands on deck approach to provide scientific solutions to the crisis. It's focused on a wide range of topics, from developing and testing new non-addictive treatments for pain, including non-pharmacological approaches as well, to innovative longitudinal studies of infants and children that have been exposed to opioids, as well as some novel implementation science efforts to bring effective and evidence-based interventions for opioid use disorders to more settings. So the criminal justice system, for example, or community-based organizations. And with this effort, NIH is working in close partnership with biopharmaceutical and other private sector groups, other federal agencies, patient groups, advocates, academic experts, and state and local governments. We go to the next slide. And now something maybe is slightly more timely even than the last example, which is something that we've done in response to COVID-19. So this is one of the initiatives that we quickly launched back in April of 2020. And that's our Rapid Acceleration of Diagnostics, or RADX Initiative. So you can see that there are multiple components of this program that are listed here. They really tried to span the gamut on testing and diagnostics, from increasing testing capacity to quickly advancing candidate development and commercialization, to even really early stage, kind of thinking outside of the box, device or other approaches, development, as well as to evaluating the effectiveness of self-tests that might be coming out of these different programs. And then finally, importantly, trying to get the right tests to the populations who need them most in the right settings, and encouraging and studying the access, uptake, acceptance of testing within these populations. And we're starting to amend this to add vaccination to this as well, now that the vaccines are becoming more widely available. And of course, a lot of data that we're hoping to generate from this effort, so trying to manage that as well. And this effort really brought together basic and clinical researchers, bioengineers, data scientists, virologists, behavioral and social scientists, regulatory and commercialization experts, community groups, and many, many federal agencies we've partnered with as part of RADX. As you can see, most of our ICs are involved in this effort in some way. We could go to the next slide. So to continue with the theme of COVID-19, I sort of feel these days you can't go 10 minutes without talking about COVID. But an important effort that we also launched pretty rapidly was the Accelerating COVID-19 Therapeutic Innovations and Vaccines, or ACTIVE program. This is our public-private partnership that is really helping to prioritize and push through promising treatments and vaccines, but in a really safe and thoughtful, effective way. So what this group is doing, and it's a group of over 30 federal, industry, and nonprofit partners that have come together to advance scientific progress. They're working on pulling together coordinated response, including identifying preclinical treatments, a collaborative framework for prioritizing the most promising therapeutic and vaccine candidates, accelerating clinical trials, including clinical trial capacity and effectiveness, but also trying to do so in a really rigorously safe way. And then finally, coordinating the regulatory process to help enable rapid authorization or approval of these candidates as they are shown to be effective or not. And I think actually one of the great things about Active is that it has had a wide range of success, right? So what I mean by that is that it has shown things that have worked, that have had some therapeutic benefit to stemming the course of infection or the disease symptoms. But they've also been able to show things that, you know, they don't have any benefit, right? And so we can rule it out as therapeutic, as a therapeutic option. So if we could go to the next slide. There are lots of other examples across NIH, and I've included 3 here on this slide. Not going to go into a tremendous amount of detail here, but I'll just point out a few little things. Our Accelerating Medicines Partnership is really focused on a variety of different topics. There are multiple AMP projects, and they're trying to basically identify biomarkers and new diagnostics to help reduce the time that it takes to get a treatment or device to the patient, as well as the cost. So pulling together a lot of people from across a variety of different areas to do so. We also have our Common Fund program, and Common Fund programs are inherently trans-NIH and collaborative efforts. They are trying to tackle pressing challenges in biomedical research that a single IC couldn't address on its own, but would be of high priority to NIH as a whole. So I included, because it's physical activity, or one of our programs called Motor Pack, that's bringing together scientists from diverse fields like computational biology, exercise physiology, etc., to really look at and interpret the changes that occur in people in response to exercise, and hopefully be able to help develop individually targeted exercise recommendations and provide insights into the development of therapeutics for those who are unable to exercise due to acute injury or other reasons. And then one that I think is just kind of fun, especially being a Floridian and watching so many launches from Cape Canaveral as a kid. We partnered with the International Space Station to quite literally launch tissue chips and organ chips into space to understand the role of microgravity on human health and diseases. And did this as recently as December of 2020. Three of the tissue chip projects traveled to the International Space Station lab up there. Thank you. One of the things I was asked to think about too for this presentation was, what are some of the lessons learned in pulling together some of these big programs and bringing together a variety of different groups? And these are 5 high-level lessons learned that I wanted to put out here. I don't think they're revolutionary, but I think they're definitely worth mentioning. First is that there's the diversity of thought, perspective, and expertise is really essential. And it is really crucial to include partners early, because it helps to create a sense of ownership. Plus, it's so much easier to adapt early on rather than later down the road when something is more formed and developed. The third thing is including those who may not seem to have a big role. Obviously, using discretion, you can't include everyone, but you really never know where good ideas may arise. And then include or consult those who will benefit from the results. So at NIH, quite often that's our patients or our patient advocacy groups. And then finally, partners and collaborations must be balanced and mutually beneficial. The ones that I've seen do the best and last the longest, that are the strongest, tend to be ones that each of the parties has a really strong connection with and a benefit from. So with that, I don't know how much time we have for questions, but I'm happy to take a few questions.
Absolutely, folks. If you have a question for Dr. Schwetz, please go ahead and put it in the chat. We have about 5 minutes to talk about a few things. I think I'd like to start off just by asking if you could tell us a little bit more about how you went from Florida State as an undergrad to NIH. What was that career path like, and what do you like about working there?
Yeah, sure. So as I indicated, I decided after my a great experience in the lab to continue that and to go to graduate school. I then, as I said, I got my PhD from the University of South Florida in biophysics. I was doing cardiac electrophysiology, so whole cell patch clamping, for those of you who know what that means and appreciate that. Looking at how essentially potassium channels in the heart work and function. And then decided to change things up a little bit and shift to doing diabetes research at Vanderbilt, looking at G protein coupled receptor signaling in the pancreatic islet, doing microscopy mostly. And then I actually came to NIH through a AAAS Science and Technology Policy Fellowship, which brings scientists to DC to be sort of embedded in the executive branch agencies or on the Hill, and to be able to, it's sort of science for policy, policy for science. So that kind of approach to be able to utilize our scientific knowledge to inform decision making in DC, as well as to learn how it all works here. And I have stuck around for a while since then.
For some of the programs that you mentioned that are cross-agency, how are those managed in terms of who is in charge, who's the lead agency, how they interact with researchers at a university level?
Yeah, quite frankly, it's variable depending on the program. So, for example, and probably one that it just comes to mind first because I live and breathe it currently, is with RADX. We have a close partnership with FDA, who consults with us weekly on a variety of different projects that we have supported through that initiative to provide input and insight on the regulatory process. It basically allows folks to come out of that process kind of already ready to submit an EUA to FDA, and hopefully helps them kind of avoid any potential pitfalls. We're still in a pandemic, right? So the idea was to really smooth out the pathway to getting an EUA for some of these projects. So that's one example where we consult with partners there. There are others where there are shared funding resources, and that's one of the ways, and it just depends on the project, on who sort of takes the lead and what the different emphases are for those projects and programs.
Well, folks, I don't see any questions in the chat. Give another minute there. While waiting, I do want to say, well, I'll skip to your next slide here if I could be so presumptuous.
I couldn't leave without saying go Knowles.
We have really appreciated having you here this afternoon, and are so very proud to have one of our own in your position up in DC, really helping to lead the National Institutes of Health, particularly at this moment in history. I cannot think of a better way for us to be celebrating our homecoming week, which completely unknown to me, it was homecoming week. But welcome back virtually to Florida State, and we are so grateful to have had you this afternoon. Oh, a question. Are there upcoming specializations or topic areas for the BRAIN initiative?
So BRAIN is launching into BRAIN 2.0, as we call it. And so they are starting to shift their focus more from, I think, tool development to sort of application of those tools. Additionally, there is a focus that will be a launch. I think they've already put out the first of probably several FOAs that are going to be focused on diversity amongst the workforce. And I think supporting a diverse cohort of researchers from across the country. The BRAIN initiative has done a fair amount of analysis to look at who they're supporting, and found that they're supporting kind of the same old, and they want to make sure that they can diversify a bit.